If you're a parent, hearing your child suddenly struggle to breathe in the middle of the night, well, it's one of the scariest sounds in the world, and it's unforgettable. The whole point of this guide is to arm you with good, clear information so you can cut through that fear and feel a whole lot more prepared. So here's our game plan. We're going to walk through this step by step. We'll start with what croup actually is, then we'll get into how to spot it, what you can do at home to help, and this is a big one, when you need to get help urgently. And then we'll wrap it all up with the key things you need to remember.
Yep, that sound. If you've heard it, you know exactly what this is talking about. It's a sound that's so hard to describe, but you just never forget it. It's pretty much the calling card of croup. Okay, let's dive right in. What is actually going on inside your little one's body that's causing that crazy sound? So at its heart, croup is a viral infection. That's a really key point. It's viral, not bacterial, and we'll come back to why that matters. It basically sets up shop in the upper airway, right around the voice box and the windpipe. And this picture shows it perfectly. That virus causes swelling right there, in the larynx and trachea. Now, for you and me, a little swelling there might just give us a hoarse voice for a day. But for a little kid, their airway is already super narrow, so that same amount of swelling can really squeeze that passage shut. And that's what creates that barking cough and all the noisy breathing. And that's exactly why croup is mostly a thing for the little guys, usually between about 6 months and 3 years old. Their airways are just plain smaller, which makes them way more vulnerable to this kind of swelling. And yeah, you'll see it pop up most often in the winter, right along with all those other lovely seasonal bugs. So, now we know what it is, let's talk about how it shows up, because recognizing the pattern here is really half the battle. You know, croup usually doesn't just show up out of the blue. It's kind of sneaky. It'll start off looking exactly like a regular old cold, maybe a little fever, a sore throat, but then things change, and it almost always happens at night. That's when that barking cough really kicks in. The first 1 or 2 nights are almost always the worst, and then, thankfully, you usually start to see things get better. Okay, I need you to really listen for this next part. There's a specific sound called stridor. It's this high-pitched, almost whistling or grunting noise that happens when your child breathes in. It's not the cough, it's the sound of the breath itself. It means that airway is seriously narrowed, and it's a sign that you have to pay very, very close attention.
I know, hearing those sounds is terrifying. But the good news is, for most mild cases of croup, there are things you can do right there at home that really help. So let's get you an action plan.
Okay, first, and this is probably the most important thing you can do, you have to stay calm. Your child is scared, and when they cry and get upset, it actually makes their breathing even harder. So your calm is their calm. Second, try cool, moist air. Wrap them up in a blanket and just step outside into the night air for a few minutes. Third, when it's time to rest, prop them up with some pillows. Lying flat can make it worse. And finally, just keep offering small sips of drinks to keep them hydrated. Now, a quick note on this. For years, the advice was always hot steam, vaporizers and all that. Well, that's not really the thinking anymore, mostly because the risk of a child getting accidentally burned is just way too high. Cool, moist air works just as well to calm that inflammation, and it's so much safer. If it's warm outside, you can also just sit with them in a steamy bathroom for a few minutes. Okay, let's talk meds. You can absolutely give something like paracetamol to help with the fever and just make them more comfortable. But remember what we said earlier? Croup is a virus, so antibiotics are going to do absolutely nothing. The only other medicine that can really help is a steroid, like cortisone, but that's something a doctor would have to prescribe for more serious cases to get that swelling down fast. All right, now for what is maybe the most crucial part of this whole thing, knowing the difference between we can handle this at home and this is a medical emergency. So let's go over the red flags you absolutely cannot ignore. This is it. This is the question that keeps every parent up at night. How do I know for sure when it's time to get in the car and go to the hospital right now? So look for these specific things. If that stridor, that high-pitched sound, is happening even when your child is calm or sleeping, that's a huge red flag. If you see their skin starting to look pale or even bluish around the lips, go immediately. Or look at their chest. If you can see the skin sucking in under their ribs with every breath, that means they are working way, way too hard to breathe. Other big signs are if they become really floppy, if they're dribbling, or if they just seem restless and not themselves. The reason you can't delay with those signs is because in some rare, severe cases, The airway can swell so much that it becomes blocked. It's scary, I know, but that's why we have to act fast. And really, it all comes down to this. You know your child better than anyone. If your gut is telling you something is seriously wrong, that is enough of a reason. Always, always trust your instincts. Okay, we've gone through a lot. So let's just boil it all down to the absolute most important points that you need to lock away in your brain. If you remember nothing else, please remember these 5 things. 1. Croup is a virus, and it's always worse at night. 2. Staying calm, both you and your child, is one of the best treatments. 3. Cool, moist air is your friend. 4. Most of the time it's mild, but it can be dangerous. And 5. The golden rule. If you are worried, get help. Period. Don't wait.
So now you have the playbook. You know what's happening, you know the signs to look for, and you know what to do. But honestly, the most powerful tool you have in all of this is your own parental gut instinct. So the real question is, now that you have the knowledge, are you prepared to trust that instinct and act on it? You've got this.